Hi everyone and welcome to our YouTube video. In this fast-paced pre-hospital setting, accuracy and safety in medication administration are critical. So today we are going to take you through our pamphlet designed to simplify medication use in the pre-hospital setting. So in this video, we'll walk you through key points which include safe medication preparations, 5 rights of medication administration, infusion calculation and setup, and unit of conversion. This is to avoid dosing errors. So our goal is to promote accuracy, safety, and confidence when handling medication. So this is our pamphlet. Those rights are further explained here in this part of the pamphlet. And down here, we have unit of conversion from gram to milligrams, from milligrams to micrograms. And down here, we also have from hours to minutes, from minutes to seconds. The next person is going to take us through drug calculation, which is Lillian.
I'm Lillian, and I'm going to be doing the explanation for the bolus as well as for the infusion. So our drug of choice is ketamine. So let's just quickly go through the calculation. For our bolus, it will be the dose required over the dose in stock times the volume that we have over 1 times the weight of the patient divided by 1. So with ketamine, the dose as per our HPCNA guideline is 1 milligram per kg. Our ampoule is a 500 milligram per 10 ml that we have. So it will be 1 milligram divided by the kg over 500 milligrams times 10 moles over 1 times the 80 for the kgs divided by 1. That will give us a solution or a rate of 1.6 moles, and it will be an 80 milligrams dosage. Alright, so for our infusion, dose required over the dose in stock times the volume divided by 1 times the weight. Again, 1 milligrams times, divided by the kg. This time we're adding the hours, divided by the 500 milligrams times 10 mol over 1 times the 80 kgs of our patient. That will be a 1.6 moles per hour. And if you divide that by 60 to get the minutes, that will be at a rate of 0.03 moles per minute. Okay, so we are going to continue with our safety. Our medical staff will have their PP on. We need to prepare a sterile working environment. They will prepare the linen saver. Once they are done with the preparation of the linen saver, we will then check our expiry dates, integrity and functionality of all the equipment as well as the drugs. And they will do that in a sterile manner. Once everything has been checked and everything is on the linen saver and properly placed, we will then prime our lines, making sure that there is no prime our line, and also make sure that we have proper IV access, ensure our patency, and making sure that our line actually runs. And we will then also attach our monitoring devices. That will be our ECG, our SATS monitor, and everything that we need. So for our bolus administration, our medical will draw up the correct dose in the syringe, which will be the 80 milligrams, as we discussed in our drug calculation. She will make sure that there's no air bubbles. If any dilutant is required, we will use that. In this case, there won't be. She will make sure that she caps the needle and she does not leave the drug full syringe unattended. Concerning her patient, she will clean the injection site. She will then administer the bolus dose based on the rate and technique referred to the HPCN protocol. She will then administer a flush after the IV administration, and she will monitor the patient during and after administration for any adverse effects and see if her desired results are met. She will then discard the used needle appropriately in the safety box.
For the infusion part, refer to the calculation that was demonstrated first. Draw up and dilute the drug appropriately. Clearly label the syringe. Label the syringe you are going to use with the patient name, the date and time, the drug name, the mass, the volume, and infusion rate. Assess compatibility of mixture if it's 2 drugs that you are using. Do not leave pre-filled syringe unattended. Prime the syringe and admin set. Ensure IV patents and attach 3-way stopcock to the patient. Correctly load your syringe in the syringe drive. And page the system accordingly. Set the infusion parameters. Monitor the infusion rate and IV site during administration. Monitor the patient during and after administration for adverse effect and desired results. My next colleague will proceed with step number 8.
Always remember, if it's not written, then it's not done. So the following information should always be written down. The time and date, the rate, the amount and dose, adverse effects and desired result, the medication name, the patient name, and ensure that you report and document any quality errors.
We hope this pamphlet will serve as a helpful guide in promoting safe and effective medication use. Again, our aim is to reduce errors and improve patient outcome. For a quick and practical demonstration, simply scan the QR code provided on the pamphlet. Bye.